Hello, everyone. This is Dr. Schroeder with a little, a review for the mental health portion of the final exam that you're going to have next week. I know many of you have been asking for or have asked for a little bit of a study guide, and so I thought that it might be best for me to actually do this a little bit via video. I can go ahead and post information up an announcement, but the problem with doing that is, well, you've been bombarded with a lot of information here these last several weeks. You've been well immersed for these last probably 5 or 6 weeks now in everything having to do with med-surg nursing, and you've been a little bit detached from the psychiatric portion of the class. Now that's fine. That was kind of by design. Most of those hours were loaded right up front, so like I said, we kind of sort of understand that. But I want you to know that I understand that it's been a while since you've seen this material as well, or that you've had to be tested on it anyway. So if your anxiety is a little bit high, just know a couple things. Is one, I understand that. And please know that there's nothing on the final exam there's no content on this final exam that you haven't already seen before. Now, it doesn't mean that every question has come off the previous exams, but it does mean that all the material that you're going to be tested on is information that you have been tested on prior. There's no new diagnoses, there's no new content areas. I haven't thrown any questions out of left field from, say, like the child and adolescent portion, or from the cognitive disorders, things that weren't covered in great detail in the class itself. Basically the content itself breaks down into four main areas. The first area is going to be on understanding concepts of mental health diagnosis. And you do have some questions where you're going to need to know the diagnosis or diagnostic criteria, or in a scenario be able to describe bipolar disorder, schizophrenia, depression. There are some questions on anxiety as well. And some of these are actually descriptions of, what are the presenting symptoms, or what does a patient look like. Many of them are posed in the way, though, that they're, how do you respond to? How do you respond to a person who is bipolar? What is the correct response to a person, for example, that is in crisis? So understand those mental health diagnoses. Again, I've really just sort of stuck with the main ones here: bipolar, schizophrenia, depression, and anxiety. So I'm not going to be having any questions on personality disorders, for example, or some of the more mundane or esoteric diagnoses. Is really the primary ones here are the ones that I know are going to be most likely that you're ultimately going to see in your NCLEX exam. The next category is going to be understanding concepts of mental illness. There are questions having to do with therapeutic communication in appropriate boundary settings. So you want to review your notes, and particularly the class handouts, I think, would be helpful with that. Crisis intervention, and how do we deal with a crisis intervention? What makes crisis intervention different from other forms of treatment of mental illness? Or review some of those concepts from crisis. You have to understand and be able to discuss or identify what the various defense mechanisms are. Remember, we talked about defense mechanisms, those terms like denial and rationalization and undoing and sublimation. You want to review those terms because you will see them on the test. The next category is going to be on safety and mental illness. Remember, we talked about this a lot. The number one concern that we have in mental health is preventing suicide and patient safety, or dealing with patients that are violent. So there are questions that are related to suicide and how we prevent suicide, and how do we handle suicidal patients. There are some medications. One of the things that is not on this test there are no medication-specific information. So I'm not going to ask you questions about risperidone or quinipatine or zolpidem, or any of the other psychiatric medications. clozaril, clozapine. I'm not going to ask you any specific medications, but you do have to have some information related to particularly the MAOI inhibitors. So you want to review notes on that. And possibly the antipsychotics and the anti-anxiety medications as well. And finally, there are questions, so you have to understand some of the biochemical influences. And again, this is fairly simple. This isn't. This is information that it should feel pretty natural to you by now because we covered it so much in class. But know which neurotransmitters are related to and impacted by the various mental illnesses. So example, you should know, for example, the dopamine hypothesis related to schizophrenia, and norepinephrine and serotonin, for example, in depression. So review those neurotransmitters. Remember which neurotransmitters are affected in anxiety, depression, and psychosis in particular. And that is pretty much the scope of the test. Again, there's nothing here that should not be something that should be fairly easy for you to get through. And I realize I say that is always kind of loaded when I say, well, it's fairly easy. I don't mean the test itself is easy, but I do mean that I do not have anything here that is that you should have to go back and reread copious amounts of your text. And there's certainly no new information on here. So there's no new, there's nothing that you haven't already seen before as far as testing materials go. I said there are no medication-specific questions. There are 2 SATA questions, so the 2 select all that apply. So you want to just be aware of that, just be prepared for that. And of course, I realize that for most of you, you're mostly focused on all the different systems and the systems of your med-surg nursing. And that's why I wanted to say that, this is what is limited here is really a fairly limited scope in behavioral health. So once again, just review the major mental health diagnoses and how to identify and relate to a patient with each of those. Understand how to deal with the patient in crisis, review the therapeutic communication techniques and appropriate boundaries and defense mechanisms. Review the high-risk medications that were covered in class, and remember that which neurotransmitters are related to which of the which of the medical diagnoses. And that should really pretty much cover most of the content that's going to be on the exam. So I am going to be available this week either via phone. I am going to be in my office on Wednesday before the final exam. That would be Wednesday the 29th from roughly 1 in the afternoon until probably 5 o'clock in the evening. If you want to send me a text or send me an email, although I am having issues with my email as of tonight. Apparently I've been getting my emails for the last couple of weeks, and not all my emails have been going out, and this is something that I just became aware of today, and I'm going to have to contact technical support to get that arranged. So bear with me if I do not send an email right away, or if I do not answer an email right away. But if you send me a text that you want to meet with me on Wednesday, to go over your test, or just to go ahead and give you some help, or just to help you with some study tips, I'm should be available to do that. So good luck, as Professor Livingston said, and as she wrote in her announcement. Remember, this is all information that you've gotten before. This isn't anything new. Everything's there. And just relax as much as you can, and take a deep breath and realize that you're almost 2/3 of the way through it. You're almost there. So hang in there, do your best, and I look forward to seeing some of you in the spring, and hopefully seeing you on campus this week. Good luck.